Hey, happy Monday, everybody. Going to get back into the routine and going through some of the common injuries that I see here in Scottsdale Sports Medicine. In the last couple of weeks, I've seen something that I see a lot of in sports, especially in contact sports in football, MMA, wrestling, called stingers. And it's basically a stretch, as we can see down in this cartoon, of the nerves plexus called the brachial plexus as it comes off the spine and goes into the armpit and into the arm. And people come in with neck pain and the pain that radiates into their arm. A lot of times it's a transient injury. It means it doesn't last long, but sometimes it will last for a period of time. Can present with numbness, tingling, sensory loss, or motor weakness. They'll weak, and they may even have loss of reflexes. One of the things I do see that brought this topic on is, I call it, in my own category, a sleeper stinger. Same mechanism. People would come in after they slept on a bad bed or their couch arm, which is typical. They fell asleep in their living room, and it puts their neck in a position that's awkward, and they'll get a stretch of that same nerve plexus, and they'll come in with a similar type of injury. So how do we evaluate that? Well, after a good physical exam and history, what we're going to do is I'm going to send them for radiographs. If it's severe, I'll send them for advanced imaging like an MRI, and then based on that, they may get a nerve conduction study if it's been going on for a prolonged period of time after a few weeks. And then we'll send them to physical therapy and then maybe some medications to help alleviate some of their symptoms. But the biggest thing is the biomechanics and trying to re-educate on making sure that they do not put themselves in a situation like that again. So a good bed, something that's moderate, not too hard, not too soft, going through sleep hygiene. They're going to fall asleep on the couch to make sure they have awareness of putting their neck into that position. So if you have any questions, be feel free to help take care of you. But that's your tip of the week.